Hello all, my name is DrMangalKardile. I work as a consulting neuropsychologist. I support different special schools, clinics, hospitals and different facilities which are devoted to disability. Today I am going to talk about BrainNext, that is our area of concentration of work for the memory and cognitive deficit, and how we recover patients from different deficits of the brain. And BrainNext, this is a product which is a copyright product, and that is divided into 18 sets, as you see on the left hand side of mine. And the exercises are a lot of exercises, which are, we can say, as 500 plus exercises, which are divided into these 18 sets. And this try to concentrate on different cognitive domains of the brain. And we have tried to cover all of the memory and cognitive areas or functions as any human brain may perform. So whatever the type of injury is, we try to help the patient with BrainNext exercises, and we have been witnessing, or we have been seeing, very positive results in all ages of patients, right from 1 year old to the elderly. The deficit may have different reasons. It may be a developmental disorder, it may be regarding epilepsy, seizures, it may be stroke, Parkinson, Alzheimer's, dementia, or any brain trauma, head injury. But BrainNext has been useful for all of these reasons where the deficit has been occurred, any part of the brain. The BrainNext is useful for recovering or helping the patient to recover just in weeks. Now we will see that on what basis the BrainNext has the foundations. The foundation for BrainNext lies in the synaptic plasticity. Now what is synaptic plasticity? That is a concept of medical neuroscience, and that works on the neurons in the brain. So whatever reasons are there for the deficit, as we have seen here, this is a typical neuron, what we have in the brain, and this is a sensory neuron, we can say. And this neuron, when is damaged by any reason, as I have said, and maybe the neurons are weakened in some of the part of the brain, we see there the memory and cognitive deficit in particular area of the brain. So what we do with BrainNext is we give directional training to this synapse or to the brain, seeing the level of cognitive deficit, and then we give directional training to that particular person, the patient, and then we see that there are positive results coming in just in weeks. And this foundation, as I said, is based on the medical neuroscience concept, that is synaptic plasticity. Now we'll see what is synaptic plasticity and what is its foundation. First, it was expressed by Canadian psychologist named as Neurorehab around 1949 in his very famous work called The Organization of behavior. So now we'll see what is synaptic plasticity and what is the Hebb's postulate. So when we give a directional training to the affected neuron, this is a typical sensory neuron in the brain. So when we give directional training to this particular affected neuron, it starts generating electrical signals through these axons, and then it generates chemical signals from this synapses. This is the end of that neuron, and then it communicates with the other synapse of the neuron. And when we give directional training for this particular neuron, it starts generating those signals, and then it generates electrical activity into other neurons which are affected in the surrounding part of these neurons, or we can say in the neuronal circuitry in the brain. And ultimately we get to see the cognitive responses from the patient and what we really desire to see. Now, how this synaptic plasticity is illustrated is when we talk about plasticity. Plasticity is itself is the capacity of the nervous system to change. So on this basis, on this strong foundation, we have developed BrainNext exercises which have been very, very useful for our patients. Patients are recovering just in weeks. And though whatever the reason is there behind the deficit, the person may be at the age of 36, we can say, having epileptic history, maybe some trauma, maybe some injury, does not require again those 36 years to recover. But the patient only requires just few months to start the recovery process. So with BrainNext, we see that patients recover almost 70 to 75% as any normal human brain perform. And we give them directional training, skill-based training, so they can be included in the society